Brothers and sisters, warm greetings from Balaji Vidyapit, popularly referred to as SBV. I am delighted to meet you all once again through Channel 1. I thank you for your continuous support in this endeavor. Today's topic is medical imaging and its implications in healthcare. Medical imaging is a technique employed by medical professionals in radiology. Radiology or radiodiagnosis is referred to as a medical subject that utilizes medical imaging to diagnose and treat diseases. Radiology has expanded dramatically in the last decade the world over. The range of radiology covers disorders across the lifespan from the stage of the fetus to the multimorbid aging population. Medical imaging has become the key diagnostic tool for several diseases and has an important role in monitoring treatment and predicting outcomes. Radiology is a deeply embedded and essential part of modern patient care at all levels of service delivery, encompassing the high-level hospital-based medicine, primary care investigations, screening, and health promotion activities. Radiology had its genesis in the year 1895, when Wilhelm Conrad Röntgen, a German physicist, accidentally discovered X-rays. The photograph of his spouse's hand was the first ever photograph of a human body part using X-rays. This historic event took place on 22nd December 1895. Over the years, the field of radiology had envisaged various innovations starting from X-ray, cassettes to ultrasound scanners to computed tomography, and currently to the very advanced magnetic resonance imaging, functional magnetic resonance imaging, and positron emission tomography. Radiology as a specialty is the perfect example of a healthcare resource shared across all levels of healthcare delivery, all medical specialties, and to patient care at all ages. Diagnostic radiology contributes to clinical workup by refining the differential diagnosis formulated from history taking, physical examination, laboratory tests, thereby decreasing the time required to initiate appropriate treatment, ultimately helping to reduce patient morbidity and mortality. Imaging helps in population-based screening programs to formulate or to assess large-scale health programs. For example, chest radiograph in screening of pulmonary tuberculosis, mammogram screening for breast cancer, and so on.
The Diagnostic Armamentarium of the Department of Radiodiagnosis at Mahatma Gandhi Medical College and Research Institute, a constituent unit of Sri Balaji Vidyapit, includes several state-of-the-art facilities. I shall enumerate one by one. the 1.5 Tesla magnetic resonance imaging machine, which is capable of advanced applications such as diffusion tensor imaging, total body imaging, MR perfusion, and MR spectroscopy. MRI is the imaging technique of choice for diagnosing disorders of brain, spine, and musculoskeletal system. Further, it also has its uses as magnetic resonance cholangiopancreatography, MR angiography, and MR venography. Computer tomography machine, which is of 128 slice capability. The whole body can be scanned in a few seconds and high resolution 3D images of any organ system can be generated. Non-invasive angiography and coronary angiograms are being offered at an affordable cost. MGMCRI is the only private medical college in Pondicherry which has this facility for coronary angiogram. 6 ultrasound units which are inclusive of a 4D state-of-the-art color Doppler units. All routine ultrasound scans of the abdomen, neck, scrotum, breast and musculoskeletal system along with elastography are performed. Transcranial, transvaginal and transrectal ultrasounds are performed. Antenatal scans, that is early pregnancy scan, NT scan, anomaly scan, growth scan and Doppler of all blood vessels are performed routinely. Ultrasound guided interventions such as percutaneous nephrostomy, liver abscess, drainage and FNACs and biopsies are also performed. A mammography unit for evaluating pathologies of the breast helps in the early detection of breast cancer. 1000 mA digital HF system with image intensifier is also in the armamentarium. One 800 mA, two 600 mA, one 500 mA, one 300 mA X-ray units are available. All regular X-rays are taken. Special procedures like barium studies, fistulogram, MCU, etc. are performed under fluoroscopic guidance. Several mobile X-ray units cater to the needs of debilitated or non-ambulatory patients. State-of-the-art DSA suite for vascular and interventional radiology can be used for various vascular and non-vascular interventional procedures like PTBD, sclerotherapy, arterial embolization, pseudoaneurysm coiling, angioplasty. With picture archiving and communication system, we have been able to store, retrieve and manage radiology reports in a more organized manner. As PACS allows images and reports to be stored digitally, it makes it easy for physicians to view images, store data and manage patient reports in a better way. The turnaround time for the radiodiagnosis department is one of the best in the city. Average turnaround time for radiography, CT scan, MRI and ultrasound is just 15 to 30 minutes. We are moving towards upgrading the MRI machine to 3 Tesla ultra-fast 16-channel with up-to-date software and further initiate the process of commissioning cardiac MRI and functional MRI. We are working towards developing interventional radiology as an independent department which can offer fellowship programs. To promulgate subspecializations such as neuroradiology, musculoskeletal radiology, chest radiology, etc. will be our cherished endeavor. To incorporate artificial intelligence in aiding the discerning radiologist, our Honorable Vice Chancellor has initiated research activities in this arena.
Research in medical imaging has the potential to improve human health. This includes basic imaging research that aims to advance medical knowledge, methodologic research to enhance technical capabilities, and clinical research with immediate clinical applications. Research in radiodiagnosis is a part of huge domain of clinical research, requiring imaging, and at present, much of this research is undertaken through multidisciplinary protocols involving clinicians and radiologists. The wide horizon of research topics relevant to radiology is constantly expanding and includes development in technology and its applications, epidemiology, molecular biology, computer science, and artificial intelligence. In addition, we need to publish research reporting on radiology's impact on therapeutic decisions, patient outcomes, and societal benefits. especially while targeting select patient populations for new medical imaging applications. Experimental research, including efforts to establish higher level value contributions. Supporting today's radiology research is a commitment to improving tomorrow's radiology practice.
Greetings from Balaji Vidyapeeth. The International Women's Day is observed on March 8th every year. The celebration of March 8th as a special day for women began in the US way back in the year 1909. Since then, 8th of March has become synonymous with International Women's Day. The theme for this year, Gender Equality Today for a Sustainable Tomorrow. Higher education is regarded as a portal to economic independence, social equity and opportunities for career women in India. Ever since the last 2 decades, Indian women have been playing a stellar role in knowledge dissemination. The women's cell of SBV, which is a symbol of women empowerment, has taken complete cognizance of this while arranging several programs and illustrious events that eventually culminated in the workshop titled Fascinating Women, organized in commemoration of International Women's Day 2022. Dr. Jayanti Ravi, IAS, Secretary, Auroville Foundation, was the chief guest of the event. Dr. Urjita Rajagopalan, Trustee, Sri Balaji Vidyapeeth, graced the occasion as the guest of honor. The Honorable Vice Chancellor of SBV, Professor S.C. Parija, presided over the program. The event, which was nicely organized by the Women's Cell of SBV at the behest of its organizing chairperson, Professor S. Soumya, and Secretary Mrs. Asha Suresh Babu, was received well, as exemplified by the impressive attendance and the press coverage.
Interventional radiology has been making rapid strides in recent years. From gastrointestinal bleeding to angioplasty to embolotherapy, interventional radiology innovators have created minimally invasive, better and safer ways to treat disease. Percutaneous ablative techniques are capable of delivering targeted cytotoxic therapy directly to tumors while leaving neighboring normal tissues less affected. Teleradiology adoption exploded in 2020 due to COVID-19, and it is likely here to stay. Teleradiology is especially important whenever a subspecialist like a musculoskeletal radiologist, pediatric radiologist, neuroradiologist or MRI radiologist is needed in remote areas on a 24/7 basis. Innovation in handheld ultrasound is revolutionizing the use of ultrasound by healthcare professionals and enable more personalized care for patients worldwide. Handheld ultrasound provides additional value as an easy-to-use, lightweight and portable tool that clinicians can have on hand to evaluate and triage patients, enabling them to conduct examinations and make decisions more quickly. Mobile stroke units are ambulances specially equipped with CT scanners for imaging the head of a patient. The demand for head and neck scanning has increased. It is widely accepted by the medical fraternity that early intervention in treating stroke patients is a paramount to their short-term and long-term outcome. Mobile MRI, state-of-the-art healthcare can be brought to almost any facility's doorstep. These mobile trailers are magnetically shielded and can be transported with the magnet fully energized to minimize setup time at varying locations. I wish you the best of health. Do remember to continue practicing physical distancing, wearing masks, and strictly adhere to hand hygiene. Stay safe. God bless you. Jai Hind.